The Guptas have travelled over 400 kilometers to come here. Their village has no specialized facilities.
5 महीने बाद दे तो दिया ये
5 months. That's what the doctors have told us before she can get her next appointment. By then she might die.
Today, we're not just here to launch a product or a preview. We are confronting the reality that most of us, most people in India especially, and most people in tier 2 and tier 3 India are heavily ignoring. The India's healthcare system, especially India's tier 2 and tier 3 cities healthcare system, it is clearly broken. And it is not broken because the doctors aren't good. They're amazing. It's because the systems that they rely on, the entire processes that they rely on every single day, they're outdated, they are disconnected, and they're unfit for the pressure that they carry. You need to understand that digitization being sold as a fix to all of these problems is not how this entire market is going to work. Digitization, as it is today, is not working. The problem here is that most digital solutions, they don't work where they're needed the most. They try to mimic something, but they're not able to actually build on it. And it's not because hospitals are not ready. Hospitals are ready for these solutions. It's because the software was not built for these hospitals. And we have seen this firsthand. Digitization fails because we underestimate the complexity of the care that is provided in a hospital, the care that the relationship that the doctor and a patient has, the complexity of the anxiety that a patient has, the complexity of all operations going on in a hospital. It's because we assume that healthcare is about screens and dashboards all of a sudden when we create a digital healthcare platform, when really it's about people and it's about the chaos. Let me tell you what most outsiders don't see, something that we observed as we went into the market and we looked at things across hundreds of hospitals and hundreds of doctors that we interviewed and discussed and shadowed. Doctors don't trust softwares because most tools slow them down. Nurses skip multiple steps because the UI does not match their actual work at all. Admin overrides the system because real emergency does not follow protocol. And patients, they still have to ask 5 times just to actually get their discharge summaries from these very intricately created systems. We have seen these things happen. A surgeon canceling operation because a nurse could not find the blood reports in the documents properly. A claim getting rejected because one word in the prescription was illegible. A 5 crore hospital running emergency shifts on WhatsApp. So it's not about UI, it's about trust. It's about the fact that we need to connect with these people and we're supposed to actually build the solution for them and not just for our own profitability. And that is what Medoc is trying to do. Digitizing healthcare isn't about pushing tech into the hospitals. It is about building systems that actually matter. The ground reality needs to be addressed. It is not to be fought against. And in tier 2 and tier 3 cities, that reality is even harder. Unstable internet, no dedicated IT staff, aging infrastructure, no margin for error. These are crucial things to understand, which most of us don't. But still, most tech is designed for urban hospitals. And then they expect that it will be scaling down directly without any change into tier 2 and tier 3 cities. It does not. And when it fails, it doesn't just waste time, it wastes multiple lives. At Medoc Health, we chose a different path. We didn't start with features, we started with fieldwork. We sat in OPDs, we shadowed nurses, we got rejected in meetings, we listened, we kept on listening and listening and listening. And that is how we built Medoc to be number one, offline first. Number two, usable in 3 to 6 hours. Number three, custom to every single hospital. Number four, strong enough to survive the chaos of the Indian healthcare system from end to end. It's not just scalable, It's adaptable, it's reliable, and it's live. Because healthcare, and especially in healthcare, reliability isn't optional, it's everything. Before we show you what we've built, let us take you through the journey that brought us here, and let's actually understand what is it that actually encompasses Medoc as an ecosystem, as a whole, as a hospital automation solution, and as a healthcare automation solution. And what is it that makes us go beyond healthcare?
Allow me to reintroduce myself. My name is...
So when we talk about Medoc and the way we've built the entire software, the core thing, the one underlying principle that we have followed throughout the entire design process has been simplification. Even if we had to rethink the entire operation of a hospital again, we have not shied away from the challenge and we have actually done it again. Be it HR management, be it inventory management, be it OPD, IPD, whatever a hospital needs, whatever a doctor needs, for better patient access and for better patient experience, we have done it. So, simplification is one word what we as Medoc Health, as a healthcare IT company, have taken very special care into. Because only if things are simple, only if digital health is simple, can it go in the background. And hence, bring our doctors, our healthcare professionals, all these better created systems and processes, and the patient's better healthcare into the limelight. So that is where we have actually focused our first core into. After that, as we obviously said, we have multiple applications in the entire suite, be it end user application, be it Hospital Plus, be it DocAssist, be it Me application, be it Pharma. So we'll be talking about all of these applications in greater depth right now. But all in all, when we talk about the ecosystem as a whole, every single application talks to the other application. It talks very seamlessly in a way which actually integrates stakeholders in healthcare together. So we're bringing everyone in one place be it insurance companies, be it pharma companies, be it nursing homes, emergency services, labs, all of those into the same place. So your documentation process, your digitalization process, it becomes seamless throughout and throughout. So one very important thing about Hospital Plus is customization and personalization. Hospital Plus is one platform which we have completely customized and personalized for the hospital. So when we deploy it into a hospital, you won't see our branding there, you won't see our name there, except for a very small powered by Medoc. And the rest entire application, everything else, it runs seamlessly, independently in the hospital's name and branding. So let's say, for example, we give every single user a single passkey. These passkeys are changed very frequently, and these passkeys are given to the user on their WhatsApps and SMSs on request. Every hospital has its own different protocols for these passkeys, and we redefine them for them. So let's assume that we're going to talk about this one specific hospital we've created just for the testing purposes. And we'll be going for the admin login for now. But when you talk about normal logins, every single user has different access roles, and according to those access roles, we have redefined the entire platform. Admin login has all of those things together in one place. So here, what you see on your screen is the admin console for Hospital Plus. Every single thing in the screen that you're seeing is customizable. It is changeable, personalizable. Your color schemes, the logo, these graphs that you see over here, all these tabs over here, all of these can be changed. This calendar over here, it can be updated according to slots. We have different slots, and every slot has X number of patients. And all of the patients and all of this data, alerts, for example, the way alerts come and how they're managed, it is all customizable and it is all manageable individually for every single hospital. We have our own admin console for this. We can customize each and everything very, very seamlessly. When we come on emergency management with Hospital Plus is absolutely seamless. We have a lot of widgets which we give as add-ons to hospitals, which are basically building blocks on which everything is built. So what I'm showing you right now, this is all foundation layer. Things are built above it. When we talk about, say, for example, this particular emergency, you get everything about that emergency, the patient, the driver or the paramedic, and most importantly, you can track the location of this particular ambulance. When we talk about location tracking and all this WebSockets and everything, what that means is that whatever is happening on the ground at that moment, you're getting live update about that in your hospital. So you can prepare for it as the emergency is happening. If it is something very critical, you can even get your staff to communicate with the paramedic right then and there. So emergencies are easier to manage with Hospital Plus. Secondly, when we talk about OPD, we have a more seamless method of presentation when it comes to OPD. Our OPDs are smarter, they are better presented, and most importantly, they are ready for modularity. What I mean by modularity is you can have different doctors presented over here for different coordinators, and depending on the same, you can also present this exact screen on any display that you want to present on the top of the OPD, however you want to do that. And patients will be able to get proper information around which appointment is coming up next. This is for walk-in appointments. For walk-in appointments, you can also have an easier, more seamless way of creating an appointment. You can just select the doctor, you can select the person, you can select the date, the time slot, and then whatever the chief complaint is, that can be mentioned here. And obviously your location. Say, for example, we are speaking from Chandigarh, and okay, so I apparently already have an appointment at that time slot. It smartly recognizes that. Take a different appointment. We take a payment, and say, for example, if you want to take it cash, we can work on cash, online, POS connections. All of those things are very seamlessly set up here. So even if you take cash and generate an invoice, it will create an entire invoice. You can get this invoice, you can print it out, very seamlessly, and it prints out beautiful visiting slips with your letterhead and everything sorted out. Then, when we talk about individual patients, you can see their entire past history of vitals, of prescriptions that they've received before this, of pre-checkups. You can have all those pre-checkups over here. You have custom pre-checkups. You can create your own, or you can have our own four. These are the four initial pre-checkups that we give internally, and their values are also very well set up. So, say for example, somebody has 100-degree Fahrenheit of fever and suddenly says it will be very critical. So we have all of those things very well set up. Other than that, once this happens, the patient then goes into the doctor's chamber, and that's a very different application that goes into DocAssist. This is with respect, when we talk about history, we have a history of the entire patients. You can do this with all doctors individually. And when you talk about upcoming appointments, we have multiple ways of showing upcoming appointments. On calendar view, you can see different slots available. So you can schedule appointments in the future, depending on what time and what slot you want, and it will book those appointments accordingly. So now when we talk about IPD, in IPD, Medoc has really made a very significant change with respect to the way it was looked. So every hospital has its own format, and insurance companies, they have their own format. uh, all government schemes, they also have their own format. All these formats and all of these methods of documentation might be different. At the same time, we also saw a very major problem in interoperability, wherein anyone who's shifting from paper to software, or anyone who's shifting from software to software, from any other software to Medoc, they were seeing a delay in the time that it takes, the retraining time. So what we did with that is we reduced your retraining time to zero by incorporating take the formats and the documentation process that you are using right now directly into Hospital Plus. So, say for example, you already have a very set document and a very set way of taking your records for IPD. We have all of that already set up in Hospital Plus, something like this. So you have different pages available, and these pages are created by us from the admin console. I'll even show you that. But then, according to these pages, you can then take all your records. So there are multiple options. You can practically create an entire form out of this. You can create an entire table out of this. You can create multiple objects of tables into it. Basically, super dynamic. And the most interesting part is what you see is not what you get. What that means is, like, for example, even if you say age over here, behind the hood, we have those things so well mapped together that it automatically calculates those things, and it automatically creates conversions and bridges the gap between different documentation formats. So, for example, when you talk about DOB, maybe your hospital follows the method of writing DOB for their documentation, and that is how your entire hospital is accustomed. Whereas the insurance company, the format that they have, digitalized acceptance format, they have complete date of birth written as it is. So we can convert that very seamlessly. This is a matter of changing formats, and the way it works is we have a very separate admin console, something like this, where every single hospital has its own passkeys, its own inventory, all these things. You can have access to your entire users. You can have access to all your different kinds of passkeys and forms, and these are the forms that we're talking about. You can create new forms. You can edit them. You can create new sections in them. You can add new fields into them. You can add different types of field. You can add as much level of complexity as you want, and your staff, which already is very accustomed to your methods, will be able to see them. This is what I'm talking about: field labels and field keys. So this makes IPD so much easier to document, to maintain, and most importantly, to understand for the entire staff. Other than this, of course, we have some generic things like ICD coding is very well followed. You can have multiple diagnoses with their ICD codes well written. Medical teams can be added here. All doctors, nurses, you can add them to the patient Only the doctors added to the to the specific IPD will be able to see the patient's details. Patient movement history can be created, family visits can be created, equipments can be assigned to this patient, and procedures can be added from multiple, like the cost of each procedure can be billed according to different charts. So if you have multiple insurances, multiple empanelments, multiple uh, custom prices, you can adjust that accordingly with different price rates. Then when we talk about surgical management, surgeries in Medoc are very easy to track. They're very easy to create. They're very easy to schedule, especially because we have a dynamic form of adding doctors into it. So if, say, for example, a doctor is already in a surgery or is occupied in OPD at that time or is occupied in some other duties at that time, you cannot mark them into the surgery. So you'll get dynamic times for what is the most suitable time for a surgery. That said, inside every single surgery, every page has basic vital tracking. It has basic medical information from drug order sheet, non-drug order sheet, IV sheets, and anesthesia records, which it is calculating according to every single specific anesthesia that we have in our system. Same goes for even staffing and equipment. Your entire team, which is doing the surgery, it will have good information about the management of every single module. So all of these things together make up Medoc's medical aspect, the emergency OPD, IPD, and surgery scheduling. This is the medical aspect of a hospital, which we have covered up very well. Other than this, when we talk about, say, for example, inventory, we have a very interesting way of presenting it. We do have modern vendor management and product details and all product save. We save all of these products very well. Their HSN codes and their batch medicines and their GSTs and all that. So the purchase department is all covered up. You have vendors very well managed. But more than that, what I've given you is recognizing when a drug is about to get expired, when an equipment is due maintenance, and when is it going to exhaust. So you can basically reorder it. You can put these things on subscription. You can set up when do you want to see whatever you want to see. You can decide when you want to order whatever is about to get exhausted. You get pre-warnings so that there's never a situation of criticality. We even have things like blood bank associated into the inventory itself. So you can have a different blood bank or you can have blood bank associated in the inventory itself. This is something we customize according to hospitals. And of course, other than this, we do have other options in the back office like staffing. So like I said, the entire staffing process, it is rethought for a hospital. You don't need extensive HRs for managing your hospital's operations if you're a 50-bed hospital. All your hospital HR is managed directly by Medoc, from attendance to performance remarks to payrolls. It is all automated. It is all very seamlessly created. Your duty rosters are all automated, and all of these duty rosters, you can set them up here. You can set them up in bulk, or you can also see any duty roster switch requests, which in hospitals we see a lot. After that, what we also have is leave records in one single place. We have overtime requests in one single place. So it is much more seamless for your entire process. All supervisors and HODs will also have access to this, while the HR department obviously will. You can add as many users as you want. We have no restriction, no bar on how many users can you actually onboard. Other than this, we have the equipment module, what you can use for tracking where your equipments are, where were issued, who issued them, when are they returned, and more importantly, when is it due maintenance, if it is due maintenance. So even if you have a CT machine, or if you have a CT scan machine, or if you have an X-ray machine which undergoes regular maintenance, or if you have some equipments in the labs which undergo multiple or regular maintenance, you can also have a good track of that with the POCs and all details very well tracked up. Then when we talk about internal communication, Medoc supports communication across the entire hospital with all the entire team, be it in groups, be it in role-based access, or be it to just nurses and to staff as a whole as announcements. When we talk about labs and scans, we have a very dynamic form of taking our radiology and diagnostics. We take it very, very seriously. All these tickets are created when the doctor prescribes it from DocAssist directly. The second thing here is that all of these individual labs. You can upload DICOM and non-DICOM formats. So it means PDFs, images, JPGs, and very complicated 2D and 3D image DICOM formats are also supported here. Second thing, when you come on diagnostics, Medoc has created its own in-house LIMS, which can be integrated with any hardware, given that it supports proper API integrations. This entire process of every single lab is divided into multiple steps, and the hospital, the doctor, and the patient are kept in track of the lab while it is being diagnosed. So, say for example, for any single patient, you have multiple samples that you can track. You can have multiple preparation methods with each sample. You can allocate the work to specific people and even specific tests. You can give it to certain employees if you want. You can give it to specific equipments. You can give any dependencies, all of those things. We also have testing parameters, multiple parameters. You can add whatever parameters you want, or if you have connected a machine, it will automatically detect the parameter required and it will add flags. You can add flags on the basis of these flags and on the basis of the uncertainties in the results. We create the entire report, the interpretation of the report as well, and technicians can also add their own notes. In the end, when you want to print the report, you can print the report as it is, or if you want to update a test, you can also update that test according to your requirements. So what this does is it makes the entire process of labs much easier. And at the same time, if you want to add validations, you can also add validations. You can have your signatures, approvals, all kinds of methods that you've used. All of those things are supported here at Medoc. So our LIMS in itself is very self-contained. You can have multiple integrations and connections, and it'll work absolutely seamlessly. Then when we talk about finances, we've simplified finances. Like I said in the start, we've simplified finances by multifolds. We've made it very easy for hospital administrators and owners to, integrate their multiple different softwares for financing, and we've made it easier for them to view their bills, to view their invoices, to view their expenses, to view their payrolls, and to also see all kinds of incomes. So all of that in one single place, you'll be able to see everything, amount, pending amount, ongoing, all of those things over here. And you also have your own wallet balance. Depending on how the hospital associates with us, we have that also set up. This is the page which individual staff members will be able to see, wherein you can see your entire clinic request. You can see your duty roster, your own leave. You can request for leaves yourselves. So you get all of this in your own branding. So the overall experience of the entire hospital also increases multifold. So your productivity as a hospital increases by multifold. So this was Hospital Plus. Then when we come to DocAssist, the doctor module, this is the kind of module we have for a doctor. This is a very dynamic module. This is available on mobile. It is available on desktop. It is available on tablets. And inside each of these appointments, you will see a very dynamic prescription pad. What happens now is every one of these prescriptions, you can create these prescriptions using voice. So it has voice integration, completely well created and embedded. If you're on a tablet, it has scribe. So we provide these tablets to every single one of our doctors, and these tablets, what happens is, they come with a stylus, and you can write your prescriptions as is, and it'll automatically detect that very seamlessly, and it'll put it up there. What that does is, even if you're handwriting your prescription, it will detect it through our 4-layer OCR, and it will directly create those prescriptions. When we talk about normal typing and templates, we have done that as well as it can be. From basic complaints to systemic examinations to diagnoses, you can add whatever diagnosis you want. To medications, we have all those tables created for medications. If you want to update the entire table as a whole, we have all of those things. We can create templates very easily just by clicking on the create template button. You can load previous templates. So that also happens very well. You can load how many ever columns you want if you have that pre-saved. You can clear all of this. You can update a template. Investigations, if you add an investigation here, it very seamlessly creates a ticket in radiology or diagnostics, whatever it is about. And same goes for follow-ups. If you create a follow-up here, the patient will receive WhatsApp notifications for the follow-up appointment, and the appointment will be created automatically on Hospital Plus on that given day and time. So that makes it much easier. Number of follow-ups increase significantly, and the patient care aspect of things stays intact. When you talk about diagnosis, we have again ICD-10 coded diagnosis all set up over here. You can also custom support your own diagnosis. When you talk about complaints, you can write whatever complaints come to you, and then the system learns as it moves forward. So this was the generic format. You can also see all your IPDs, your radiology, your surgery over here itself. Even if you're in your OPD, in your cabin as a doctor, you'll be able to see all your IPD, all your admitted patients, your upcoming surgeries, the records of any surgeries, the records of any labs right over here. And say if this is a woman, any time a woman comes to a gynecologist, our system automatically detects it and it provides the entire, given that the woman has given consent, it provides the entire period tracking, IVF if ongoing, and all kinds of trimester tracking features available to the gynecologist or the OB. Secondly, if it is a nephrologist or if it is a pediatrician or if it is a cardiologist, we have custom sections created, custom Medoc specific sections created for them, wherein they can access the specific information that they need for their work. So those are specialty related things that we have created here. When we talk about your normal patient and your entire list of patients you can get all over here, this entire system, it makes it very easy for a doctor to write their prescriptions through voice, through your interaction with the patient. So you don't need to actually talk to the system. You can talk to the patient as you do, and you can even write it on a paper. But whatever you're saying, if you're dictating it, it will automatically create that prescription. Especially helpful for medical histories and for IPDs, wherein you don't have the time to actually write every single thing, and your conversation in itself becomes great for instructions. And this even tracks your patient's symptoms, so it becomes easier for documenting that as well. This is what DocAssist looks like on a mobile phone. You have all your prescriptions, all your details over here. You have your voice prescriptions and prescribe button over here. And at the same time, you have all your notifications and alerts right here. You can search for specific patients. You can see the history of all patients, their labs, basically all the details that you need for any specific patient and your own profile. You can set up whether or not you want to share these prescriptions to the patient on their WhatsApp. You can also switch between hospitals, and you can see basic analytics about your profile. When you talk about Medoc Plus is not one application, it's three applications embedded in one. We have nursing services wherein nurses get access to specific patients very easily. We have emergency services, which means that your paramedic and your driver will have that module in their ambulance, in their hands when they're there for you. It's going to help them access your records. It's going to help them access better facilities, and it's going to keep them connected with the hospital at all times. At the same time, for pharma, we have different module which is connected to your pharmacy, which is connected to your inventory, and you can access and you can provide specific equipments and specific inventory items directly to the staff, to the patient, or to the nurse, whoever you're assigning it, and then they can assign it further to the patient. So this makes the entire workflow much more simple. The most important thing here is if any of these employees move away from the track or from the hospital premises, this application locks out. Given the duty roster and given the timing that they have for the duties, if they are not on duty, they will not be able to see any patient records. Any patient records which are not assigned to them are not visible to them. So these are some security features that we have embedded so that your hospital's data stays with you. The Me application is a single application which you need for all your healthcare related needs. You have emergency, family, your own profile, your day-to-day health, your daily metrics, prescriptions, appointments, all of these things in one single place. It makes it super simple for any patient to actually operate and to actually live their life in a better way. In appointments, you can see all the hospitals that are integrated with Medoc and which are around you. You can see all your labs. You can avail for different lab services. You can avail for different tests. We have different packages here. For any kind of emergency, we have a very separate tab wherein if you're an observer, you will get to see the live first aid, the life support that you can do to save the patient, and you'll know exactly when to stop. If you don't know what to do, you also have a live call feature, which is a lifesaver. And if you want to request an ambulance, you'll get live tracking of that ambulance and where it is right now. So all of those things make emergency tracking very seamless in Medoc. One of the most crucial things, and when every second counts, this is what is going to help you out, save your own life or save some loved one's life or some other person's life. When we talk about family, you have the entire family in one single place. So you can access your elder parents, you can access your grandparents, you can access your children's history, you can access their basic services, you can add them into the family for all kinds of services. Then when we talk about prescriptions on Medoc are very beautifully interpreted. So it's not just about the medicine, it's also about how you should take it. What is the meaning of the medicine? What is the meaning of the prescription? And how do you read it? Daily health metrics in Medoc are not just a normal addition. It's not just a health tracker. It's much, much more than that. At Medoc, we're trying to build a community with daily health. But as we move forward, we'll be working on that. What we are doing right now is with women's health, it is connected with gynecologists, it is connected with OB. And whenever there's any criticality, the doctor can access your records as you share them. We have period tracking and menstrual records on the application directly. When you talk about exercise, we have modules created for multiple levels of modular exercise, which can then be shared with your cardiologist or your doctor. We have a diet section which can be modified and created by dietitians for you. It can be tracked and it can be monitored by your dietitian, by your team. For vitals, we have this entire module wherein you can connect multiple smart devices to the application so that you can track your vitals. So all of these things together with multiple other services like insurances, like pharmaceutical services, like in store, all of those things together make me application the single application which is about you. When we talk about me app, it is about you. It is about everything associated to you. It is associated to emergencies. It is associated to prescriptions. It is associated to your day-to-day life, your food, your exercise, your health, and most importantly, your loved ones, your family. Last thing that we have today is Medoc card. Medoc card is a very, very simple card which works as an alternative to me. What it means is that people who do not have smartphones, people who do not have access to proper technology, they can also get access to digitalized records. They can also get access to digitalized reports. So your hospital can create referral programs. It can create proper digitalized programs wherein the data is digitized. And whenever the patient comes back to the hospital, you can access their records, all their past records in one tab. When you talk about onboarding process, at Medoc, we have made onboarding hospitals super simple. We give you a one-page form, which is as simple as this. And that single form is all you need to fill. And then we give you a simple Excel sheet wherein you can upload your entire rates, you can upload all your current patients if you have any. You can upload any of your current ongoing processes, whatever documentation that you have right now, you can upload it directly from the portal itself. So we have all kinds of bulk uploads, be it doctors, patients, patient growth. You can upload vitals if you have any separate methods of uploading them. So these are not things you have to do as a hospital. You can give it to us and we'll do it for you. Secondly, when you talk about forms, you can view and create as many forms as you want. You can add as many users as you want. We have no limit on that. If you want to add 500 people in your team, you can add 500 people. If you want to add 2,000 people of your hospital, you can do that. It will never be a problem for us. Secondly, what you can do is you can check your entire wallet. Basically, this is the balance that has been created by using Medoc. So that is one more thing that you can do here. You can refill it as you want. So this is how onboarding a hospital looks like for us from our side. It takes approximately 2 hours to onboard one hospital with all their documentation and everything completed. And it takes approximately 7 days to train your staff for Medoc. So they'll be ready to use the software in less than or equal to 7 working days, which is commendable given the market stances. Before we close and get to the next agenda topic, let's talk about what this actually means operationally. Every single module that you saw today, it is all already live in partner hospitals, and this isn't a prototype that we're showing you. This is a working system. This is the bare minimum and skeletons of all the upgrades that we can have, the capabilities of Medoc, and actually a glimpse of the same. And Medoc as a system is modular. You can start with one piece, or you can integrate the entire stack together, from billing to pharmacy, from voice prescriptions to real time dashboard, from patient records to claim and compliance. We integrate the entire hospital infrastructure, labs, insurance system, and are fully compliant with ABDM, SNOMED, NABH, HL7, all of these top notch protocols, along with being ISO 27001 and ISO 9001 compliant. When you talk about data security, it is a non-negotiable when it comes to healthcare. We encrypt every single layer in transit and at rest. There is very clear role-based access. There are tamper-proof logs, and with Hood coming soon, we are preparing for zero trust and we're preparing for blockchain secured interoperability right from day one. At the same time, I already highlighted multiple interesting features like your geotagging and duty roster based access. All of those things ensure that your data, your hospital's data, and your medical data, it does not get leaked out and it stays in your hospital itself. The point is, whether it's a 25-bed unit or a 50-bed tertiary hospital, Medoc is built to adapt. It is built to run light, it is built to run deep, and most importantly, it is built to run reliably.